Thank you. Could I turn to Dean Russell for the next question, please, Dean?
Thank you, Chair. My name's Dean Russell. I'm the Member of Parliament for Watford. And as you'll be aware, this week marks a year since the Panorama documentary, which unveiled horrific abuse of patients at Walton Hall. Glynis Murphy's review of this CQC's inspection of the hall was published in March. And that concluded that the abuse could have been detected sooner if you'd carried out more unannounced visits. Now, the report made a number of recommendations for how inspections should be improved in the future. And in our report that we produced within this committee prior to my time on this committee, you had said that you will incorporate Professor Murphy's recommendations into a new strategy to improve the regulation of mental health, learning disability and/or autism services. And I know you've covered quite a lot of ground today, but I'd just like to know where you've got with this, what's been done, but also when you were talking earlier about the visit, are they intended to be unplanned visits, or are they planned visits? Do you want to be assured of that you're going to be carrying out those particular recommendations, please?
Thank you. So if I start and then can hand over to Dr. Cleary. So in autumn, we published some supporting information for our inspectors about how we need to tailor our approach when we're going into services classified as closed environments. So we've supported our inspectors to be clear in identifying when a service may have a closed environment and how they need to work differently with it. So things such as they should ensure that they take an expert by experience on their visits. They should seek feedback from families and advocates before they arrive at the service and plan their inspection differently. So that information was published in autumn. As you say, Professor Murphy's recommendations landed with us in March. There's a whole programme of work that's underway that I oversee to deliver those range of recommendations. We as a regulator are looking to our new strategy that we will be having a conversation about with the public in autumn. That's very much about how do we remain as a flexible regulator as services out there in health and social care change at the pace it does. And the learning from Glynis Murphy's recommendations will also go into that. So how do we use intelligence? How do we ensure that at every point we're hearing the voice of people with lived experience with how we regulate? Dr. Cleary, do you want to add to that?
Dr. Cleary, sorry, just before you do, can I just add a small point on that? We heard some really heartbreaking evidence prior to your joining as witnesses earlier. In those circumstances, when family members are raising those sorts of concerns, are we making sure that those locations are then getting them planned visits, or is it a very long process of bureaucracy and red tape? I'm just very conscious those were very heartbreaking stories, and I just want to make sure that we're clearing, we've got a really clear guide to families of people who are giving such evidence that will then get looked into according to the results of those reports that were made.
No, absolutely. So thank you for giving me the opportunity to respond to that. So yes, when those concerns come in, either give feedback on care, or if people ring our contact centre, our staff are skilled at identifying when what's being shared with them might be a safeguarding risk or a risk around the quality of people's care. That information gets passed rapidly to our inspectors, who then make the decision about whether to bring forward an inspection or whether to make a referral to the local authority safeguarding team, or on some occasions potentially bring in colleagues from the police. So yes, we have the mechanism in place. As you say, one thing that really stood out for me from the earlier panel members, I think it was Andrea who talked about raising concerns with CQC that led to a visit, but she didn't think the visit adequately addressed her concerns. If I may, Andrea, if I could take away a personal action to have contact with you and follow up on that specific case, I would really welcome the opportunity to do that.
So from Mental Health Hospital's point of view, we definitely respond to complaints, and I think promptly. So our visits, which we have undertaken this week, are as a response to intelligence that we received last week. And we are aiming to respond where necessary within about 4 to 5 days. It takes a couple of days to get PPE to our inspectors. but we get out as quickly as we can. And they are unannounced. All of our visits at the moment are unannounced. I came to CQC in September last year. I'm working in a sort of provider organisation, and I strongly believe that in high-risk environments, unannounced visits are of the primary importance. You can't be telling people 3 months in advance that you're going to come out and see them, because it provides people with an opportunity to prepare. So in future, in mental health, it is my intention that the majority of our visits for the foreseeable future will be unannounced visits.
Thank you.
Yeah.
Sorry, I didn't mean to interrupt you. Please carry on.
That's all right. Yeah, no. The other thing I was going to say was that Glynis Murphy's report was part 1. There is a part 2 report that's coming out in the next few months, which will be looking at some of the things that the Joint Committee raised last time, including the issue of covert surveillance in closed institutions.
Thank